Welcome back to The Advisor for evidence-based health and high performance. Follow and subscribe so you never miss an episode. Quickly, I just want to mention to you, that I want to thank Volition Beauty. I created the Dandelion Lifting and Firming Neck Serum for Volition to help the neck and make you help it look smoother and more lifted. It's on pre-sale now and at limited quantities at volitionbeauty.com/Stacey Chillemi. Now today I'm really excited because we have a very special guest today. Her name is Carolyn, and she is a hormone specialist, and she's here to unpack the science and real world results of bioidentical hormone therapy. Carolyn, it's such a pleasure to have you here. I'd like to welcome to our show. And can you tell everybody a little about yourself and who you are and what you do?
Sure. I'm Carolyn Zaumeyer, nurse practitioner and bioidentical hormone expert. I've been prescribing hormones for, oh, geez, almost 40 years. I know I look 17, but it's been a long time. And I started off with the Premarin and the Provera before bioidentical hormones, and I just really fine-tuned my prescribing skills and have the number one hormone practice in Florida. I've been ranked number two in the nation, they say. Not sure how that's calculated, but I'm also the number one NP thyroid prescriber in Florida. And I dove into thyroid to complement what we do because the symptoms of a sluggish thyroid can overlap with low hormones, and you don't want to fix one and still have you still not feeling well. So I really dove in and studied that. But as you probably know, bioidentical hormones are not taught in school for medical school or nursing school. I think it's like maybe 7% of the medical schools. There's some statistic in my book of where they actually teach it. So anything your traditional doctors know about it, they must have, learned in a journal or went outside to learn it, or haven't even bothered. So
Yeah.
that's my forte. And I have a very good relationship with the physicians in town that refer, and I refer back and the whole bit. But recently, when I do my consultations, I tell people about the benefits of aging with hormones, not just the feel-good effects, but the safety, and then how much healthier it is to age with youthful hormones. The hormones we use, the bioidentical hormone pellets, have been used in this country for well over 80 years. And that's my forte, is the bioidentical hormone pellets. And the first studies I can find are from 1939. I ran into the pellets in 1979. I was training in surgery in Memphis. We did a hysterectomy on a woman, closed her up, rolled her over, put the pellets in, so that when she woke up, she wouldn't feel so bad. So since they've been used in this country for so many years, we have hundreds of studies showing not only the feel-good effects, but the safety and also how much healthier it is to age with youthful hormones. Our studies are showing decreased cardiac issues, osteoporosis. The testosterone actually helps rebuild bone, arthritis, Alzheimer's. Some studies are showing up to a 50% decreased risk, and even breast cancer. We have two researchers right now producing studies showing a 30 to 40% decreased risk of breast cancer utilizing our testosterone pellets. So that's crazy good. I mean, there's so much, the big scare with hormones is breast cancer. And to have these researchers focusing in on it and doing this, it's fabulous. I also have learned that there's not one study that shows that estradiol causes breast cancer. Not one.
Really?
So what's our big scare? It all started with the Women's Health Initiative back in 2002. It was a
Hmm.
huge study that was done, and sorry, that had thousands of women in it. And they actually had to halt the study because it was so poorly designed. They were giving the wrong hormone, which was synthetic, the wrong delivery system, which was oral. So it had to go first pass through the liver. And then also they gave everybody the exact same dose. They didn't personalize it. And so they have dissected this study, the results of it over the years. And that's why you're now hearing, ooh, hormones are now safe for menopause, because they're looking at, there was one arm of the study for women that don't have a uterus. They don't have to take progestin or progesterone. That arm of the study that just got the estrogen did fabulous. They actually had a reduced rate of breast cancer, heart attack, deep vein thrombosis, Alzheimer's, and all that. The ones that had the problem were the ones that were paired with a synthetic progestin called Provera. And that was Prempro and Provera, or Premarin and Provera we started with, and they put it all together to Prempro. And that Progestin is supposedly the culprit that was the bad thing. We don't use synthetic at all. We use bioidentical progesterone, which is the polar opposite. It has none of those characteristics. So what we have is a very safe way to get women to feel well, and men. I do treat men. About 30% of my practice is men for testosterone pellets, and getting people feeling better.
Yeah.
You know.
That's wonderful. Now, what exactly is bioidentical hormone therapy? Because a lot of people don't know exactly what it is. They've heard about it or they have misconceptions, like we were just speaking about. Can you go a
Mhm.
little more in depth and explain to people?
Absolutely. Absolutely. It was interesting. I was working with a traditional medical doctor, a gynecologist, and I was prescribing Premarin and Provera. This is 100 years ago.
Hmm.
And I was sharing a desk with him because I didn't feel like I knew enough when I came out of school. You know, you always need to learn more. And so I was learning his different treatment programs a whole bit. And I noticed a trend with him with the menopausal women, and it said psych referral, psych referral, psych referral. So finally, I go to him with a big stack of charts, and I'm like, listen, all these ladies can't be nuts. And he said, oh, yes, they are. He says, they're sweating, they're crying, they're miserable, their relationships are a mess. They need to get their lives together. And I said, well, can I have those patients? And he's like, God bless you. You take those. You take the old birds. I'll go deliver babies. And I'm like, perfect. So that's when I really started diving into it. And this was like in the early 90s. And I was getting such positive feedback from the women about how well they felt. You know, I feel so much better. I like myself better. My husband likes me better. Life is better. And I'm like, okay. So that egged me on to keep going and studying. And then when the Women's Health Initiative came out, I'm like, oh, crap. About 80% of the American women went off their hormones because of this poorly done study hitting the front page of the newspaper that hormones cause cancer, which they don't. If estrogen caused cancer, it's the highest when you're pregnant. Wouldn't
Right.
all pregnant ladies have breast cancer if that was the case? It doesn't. It's a healthy hormone. And
Yeah.
and so with that, I thought, okay, I've got to find a way to help these women because they were doing so well. Now they're going to come off this, understandably, because the headlines were horrible. And
Yeah.
so I had heard about bioidenticals, but I didn't know what it was. So I actually had to search out what are bioidentical hormones. So what the bio stands for is biology, meaning it's plant derived. Our products are actually derived from wild yams. The
Yeah.
identical is referencing the structure of the chemical molecule in our product is exactly the same as what our ovaries produce. Our ovaries produce both testosterone and estradiol, but as time goes on, we produce less and less, and we don't feel well. We don't feel like our old selves. And
Yeah.
even young girls, I get young girls that have just, it seems to me that pregnancy is tanking the testosterone. And it may have a thing with postpartum depression. I don't know if
Mhm.
anybody's looked into that, but the testosterone helps with anxiety, depression, mood swings,
Yeah.
relationships, and such. So I've got young girls coming in that even reproduce, and they're like, I got a perfect life, perfect husband, house, baby, everything's good, but I don't have that chemical feeling. I don't have that loving feeling.
Yeah.
And I test her testosterone. It's so low you can't measure it. Optimize her testosterone. She comes back in 6 weeks for her labs, and she's feeling like a superstar. She's like, "Thank you for giving me my life back." So that one chemical, if you're missing it, it's not your fault. It's just your ovaries stop producing it or declined with it.
Yeah.
Just fixing that can make all the difference in the world. Just with how you feel. So my youngest patients are in their early or late, mid to late 20s, and then my oldest is 92 and is still playing tennis.
Hmm.
So it's like, how do you want to age?
Yes.
Like if you want to age like an apple you put on the counter, go back 3 months and look at it. No, that's not me. So
Exactly.
that's aging naturally.
I love it. I love it. Now, how is BHRT different from traditional HRT or synthetic hormones?
It's just what I was saying. The risks of the synthetic hormones are bad,
Okay.
especially the progestin. And then the bioidentical has more health benefits. Sure, with any hormone therapy, you can have a little bit of breast tenderness, nipple tenderness, a little cramping in the beginning. And that's usually just in the first 4 weeks of treatment. But
Yeah.
that usually goes away. And it's showing it's actually so protective for the breast, and the testosterone therapy is actually protective for men's prostates.
Yes.
So they're apples and oranges. I picture the synthetic hormone like a square peg trying to go in a round hole. You get some symptom relief, but the rest of it is left to wreak havoc throughout the body, affect the liver, the heart, and all that. Where
Right.
ours is just like your body just kind of thinks you're naturally producing these hormones again and again. The little
Yeah.
pellets we use when we insert them, when your blood supply passes by, it picks up the little micro pieces of hormone and
Yes.
gently raises your hormone levels up during the first 4 to 6 weeks, and holds them steady 3 to 5 months for women and 4 to 7 for men. So men only have to come in maybe twice a year. So
That's
I had a guy
great.
fly in from Ohio the other day, to get his pellet, and then he was going to go back home.
Right.
So,
Oh, that's amazing. Now, what's the first principle people must understand before starting BHRT?
I guess just have the confidence that what you're doing is not hurting yourself.
Yeah.
What we do to get people started is they go to our website, which is LOWTE, Florida, spelled out.com. And there's a initial patient packet that they fill out online. Once that goes in, our new patient coordinator, Brazil, will reach out and get everything together. If you have lab work that you can submit, a mammogram report, she gets all that together, and then we schedule about a 20-minute phone conversation just to go over everything and see if this is appropriate for that patient. And I
Right.
make my plan. And then if they want to go forward, then we schedule an appointment for them to come in, get their pellet, which is like a 20-minute visit. And they get copies of everything and all scheduled up for their next lab work we do for women 6 weeks after the treatment, and for men 4 weeks after, just to make
Oh,
sure that the dosing is correct. And if we need to dial it in, I give more for no charge. I just want to get you there happy and healthy.
right. Oh, that's wonderful. Now, when it comes to like from clinical lens, what does the evidence say about safety when a BHRT is properly dosed or monitored?
It is very safe, very safe. I wouldn't have a practice based on this if it was causing problems.
Right.
And it wouldn't be a good business model.
Yeah.
Oops,
No,
all
of
my
course.
patients are dying. No. So it's actually a healthier way to live. I've been on the pellets for 15 years. I'm 65, and I still feel like I have that energy. What I first noticed when I had tried all the different delivery systems, the patches, the troches, the shots, everything. I tried everything under the sun. And until I got the pellet, I didn't feel well
Really?
because yeah, I had a very busy insurance-based gynecology practice, and I was working so hard, and I'd work hard, hard, hard all day, get home, and my goal was to feed and walk my dogs, two big old black labs, put my jammies on, pour a mug of wine, and hit the couch. I was just exhausted. After
Yeah.
I got the pellet, I realized about 2 weeks in that, oh my gosh, I got my second half of my day back. I wanted
Yeah.
to do the things on the list of things to do. I wanted to go out. I wanted to live life.
Yeah.
Before that, I remember laying on the couch talking to God saying, was I put on earth to work? If so, I'm doing a good job. But I think there's supposed to be something a little bit more than just work,
Yeah.
but if
Exactly.
not, I'm good. And then this happened, and I was just like, holy Mac, I got it.
Wow. Yeah, no, definitely, definitely. The reason why I asked you that question is because I have met so many women that, they've heard of hormone therapy, but they don't know about it. So they fear
Yeah.
base it. And so they don't try it out of fear. And there's so many benefits. Or they just, they hear those things like that study you were talking about that was completely false, but,
Yes.
they hear about it, they get scared, or they just don't know what to expect. So change, that brings fear. And so they don't want to try it. So I just wanted you to reinforce people how beneficial it is because, you're on it. I'm on it. I feel a humongous benefit from it. And obviously you've been on it for 15 years, I think you just said,
Yes.
right?
Yes. Yes.
You feel a huge difference also.
Yes, absolutely. And what the problem is that there's so many myths and misconceptions, of hormone therapy. And one of my big peeves right now, pet peeves, is the reporters on the national news are not reporting it properly. I just
Yeah.
wrote a letter to a doctor that was on CBS in the morning, and the report was what they're doing is they're taking that one study from way back when,
Yeah.
and trying to spin it that, okay, hormones are now good for menopausal women. Great. Yes, they are, but they don't differentiate between bioidentical and synthetic.
Yeah.
So she does the good report, but instead of saying progesterone, instead of saying progestin, reporting on the bad, she called it progesterone all through her reporting. If any of my patients had seen that, they would have never taken progesterone. They go off it, which unopposed estrogen without progesterone can lead to uterine cancer.
Right.
So I'm like, oh my God, I wrote her this letter and sent her my new book. We'll see how that goes over. But anyway, it was just like, I couldn't believe it. I get so excited when I see the little teaser that, oh, hormones are now safe for menopausal women. They're going to report on it. But then they screw it up. They don't give the right information. Then from that study with the synthetic, they'll say, oh, yes, unless you started before menopause, you won't have the benefits of the health, of the good health, which is not true. And then they'll say, oh, you should only be on it for 6 years, or, they'll give a little time frame, the least amount of hormone for the shortest amount of time. Okay, you're 50, you got another 50 years to live. So you get to feel good for a minute, and then we're going to take it away. And that's okay. No, it's not.
No,
So
it's
that's my life, my world. Always trying to dispel the misconceptions.
well, there's a lot of it out there. That's the problem is that,
Yeah,
you hear so many myths and misconceptions. I see it all the time, even on social media, and,
yeah,
they're just
yeah,
not reporting it properly. And I say to people all the time, because you got so many people out there trying to be Google doctors, and, they look up this information. It's false, it's written improperly,
right.
and they think that it's actually accurate, and it's
Yeah.
not. You
Yeah,
know,
just because it's written on the internet does not necessarily make it correct. I mean, I read once that blow dryers cause brain cancer. I think I'd be dead by now if I get my blow dryer. But anyway, what tickles me is people will call me, even established patients. Well, I've been researching hormones. Really? I've been researching it for about 40 years. What'd you find? But it's all of a sudden they're the expert because they read an article or whatever. But I love patients with questions and smart patients that come in with their little list of questions or little concerns or whatever. And then with my book, I can point them to an article that'll actually show them the science behind what I'm saying. So
Right.
I wrote the book. I didn't write the book to become a bestseller or to make money off it. And actually I'm losing money with it because I give it out for free. It's
Yeah.
on my website, lowteflorida.com, and you can actually put in there and we'll mail it to you for free. I just want to get the good news out there. So business wise, it wasn't a good decision to offer it up for free, but I want people to know the difference and know that they can feel good safely. Go
Yes.
to a well-trained provider that knows what they're doing, because hormones are powerful. And if they're not done properly, like we were talking before about over-the-counter estrogen products, even if it's a phytoestrogen, if you're not opposing it with the progesterone, the lining of the uterus can grow and make a perfect place for a cancer to grow.
Exactly.
So doing it naturally by yourself over the internet, yeah, you're playing Russian roulette with your
You
health.
are. You are 100%. Now, which labs and biomarkers actually guide your protocols, and how often do you test?
We do a very extensive initial lab panel because I want to know you're healthy. And so we're testing your red blood cells and white blood cells to make sure you're not anemic, have leukemia or infection. We test your kidneys, heart, liver enzymes, your sugar, your hemoglobin A1C, which is a predictor for diabetes, which really doesn't have much to do with what we do. But I found so many pre-diabetics and diabetics that hadn't a clue that they were, that
Yeah.
just eggs me on to keep testing that. I test the thyroid 4 different ways. Traditional medicine tends to look at just the TSH, which is your brain telling your thyroid to produce hormone. I want to know what's circulating in the body that's helping with your energy, mental clarity, metabolism for your weight, your hair, your heart, your skin, all that. And then
Yeah.
also we test the hormones, of course. For women, it's estradiol and FSH are my guidelines. And testosterone. And for men, we test the testosterone, the free testosterone and PSA, and for the prostate. For women, also we do, besides the thyroid, we do vitamin D as in dog, because even though we're in Florida, over 90% of the people that I test have low vitamin D. We're not absorbing it through our skin anymore.
Yeah.
And it's critical for your bones, your teeth, your mood, prevention of certain cancers, and even prevention of COVID. They said that every single COVID patient admitted into the hospital had low vitamin D, to the point that
Yes.
they quit testing it. They just kept giving everybody a vitamin D shot when they were admitted because they knew that they were low in vitamin D. And almost every disease process that I read about, like my brother has severe MS, by low vitamin D, boom. So it's like keep your vitamin D optimized. The range
Yes.
is wide, it's like 30 to 100. We like to see between 60 and 80 because
Yeah.
that's where the latest research shows you get your best benefit for your bones, your teeth, your mood, and all that good stuff. So we tested vitamin D and B12 for energy, and I think that's about it. Yeah, that's good. And that's our starter. And I use that, for the initial consultation and making recommendations. And then if we need to add more tests on, we can do that. Some people like to test their lipids just for sport, I guess. And I don't know. Anyway, I read an article once that over 60% of the people that went in for open heart surgery with complete blockages had a perfect cholesterol on paper. So why are we chasing these numbers? Get a
Yeah.
calcium score, find out if you have plaque, go from there. Um, what else? Then our 6-week labs or 4 weeks for men, we're just basically retesting the hormones to dial in the dosing. And then also to check some men and women, very few women, but more men will have a higher red blood count or hemoglobin or hematocrit. We need to know that so we can set things up to get that lowered. And then also we check the estrogen because some of men, their testosterone will want to aromatize into estrogen, and men need a little bit of estrogen, but not a lot. And so there's another treatment for that if that's happening. And it doesn't happen to everybody, it's just some, but that's why we have to follow the labs. I like to do the initial labs, the follow-up labs after the first dosing, and then maybe depending on what their lab showed, maybe at 6 months, and then at a year. But for dosing, I rely mostly on, after I've done the initial and the follow-up, mostly on what the patients tell me of how they feel. How did you feel with your last pellet? Because some women feel good when their testosterone is around 150. I feel better when it's 350 or 400.
Right.
Everybody's different, and there's no harm at running at those levels, but finding that space, where they feel, and that's how we really dial it in and personalize it. And, they'll
Yeah.
come in and I'll say, okay, how was it? Oh, I still have some night sweats. Oh, okay, we need to increase the testosterone a smidge. Let's take that up. Are you having hot flashes during the day? Oh, may need to raise up the estrogen. Or I have breast tenderness the whole time, so I need to decrease or hold the estrogen. So it's really what that patient's experience is because everybody is so very different in how they metabolize it and what they notice.
That's very true. Now, what patterns do you see when it comes to sleep, mood, libido, and all those? Do you see a pattern when it comes to
Yeah, well, it was interesting when I first started doing this. I thought that more people would be coming to me about the libido, about the sexual part of it. And
yeah,
because they're called the sex hormones, so that's what I thought most people would come. The number one reason people come to me is fatigue. And with that fatigue, what ties into it is anxiety, stress, um, hot night sweats for women,
yeah,
and a low testosterone. Testosterone takes care of that. The testosterone really helps with the sleep, the night sweats, the moods, the energy, and all that. And so sleep, energy, fatigue, that all kind of binds together, and then you can throw in the night sweats. Then probably would come weight. A lot of people are having issues with their weight. And I never promote this as a weight loss program, but you're giving your body what it needs to function properly. And so what I find is the more better people feel, the better food choices they're making, feel more like exercising. And without an
right,
optimal testosterone level, you can exercise all day, all night. You're not going to build muscle. You have to
yeah,
have an optimal testosterone to build muscle. You can tone and keep what you have, but you can't build anything.
yeah.
So workouts feel better, the results are better, and even the recovery is better. So those anxiety falls in after that, and then libido and sexual function. And it really we tag hit all those, and there's like so many that I go over, like anxiety, depression, mood swings, sleep, sexual thoughts, sexual satisfaction, joint pain, temperature swings like hot flashes, night sweats, vaginal dryness. That's a big one if they've been without estrogen for a while, and even
Yeah.
joint pain, even joint pain. But that's just the tip of the iceberg. There's so many other things that your hormones affect, your emotions. Are you crying over stupid stuff? You need some estrogen.
Yeah. I see
So,
that all the time. And I remember when I first started going through even perimenopause, I couldn't even get out of bed. All of a sudden I had all this energy and all of a sudden the energy just dissipated and I couldn't, it was like actually like a workout just to roll myself out of bed because I just had no energy whatsoever. And along with everything else that you mentioned, all those other symptoms, but that was the one thing that hit me the most because I never felt that fatigue in my life.
yeah,
It was
yeah.
such a high level.
Yeah, I do a lot of like print ads and newspaper, just to make sure that the other people doing hormones know I'm still working. And one of my favorite titles on my strip ad on the Sun Sentinel is "Are you tired of being tired?" Because so many people have been going through this for so long, that they
Yeah.
think it's almost like normal, and then after I optimize their hormones, they're like, "Oh my gosh, I didn't know how bad I felt until I felt well." And
Right.
that's a nice realization. And then couples, oh my gosh. In the forward of my book, two of my couples that I treat, both of them wrote testimonials and talked about their experience of working with me. One of them got a little graphic, but might get me pulled off the bookshelf. No, but they say it really made such a big difference in their relationships. Both of them, I think, have been married for 30 years, and it just kind of rekindled those loving feelings and made them kinder and nicer to each other. And I see them on Facebook, traveling in Europe and just having a good time bicycling and all that good stuff, like a good
Yeah,
TV commercial.
I love that. I love that a lot. Now, what
Yeah,
early wins are realistic in the first 30 to 90 days? Because, in our society, especially, everybody wants fast results. It's like, it's just like we've become so used to the technology and getting
yes,
answers really quick that they think when you go to the doctor and you start like hormones and you start different
mm,
things that right away you should see a result.
yeah.
What's realistic?
What I tell people is it can take, 4 to 6 weeks for women for those levels to get up there. Not saying that there's not more good things to come after that, but that's when we test the labs and things should be kicking in by then. And but you may notice things sooner, like a couple of days after I get my pellet. I feel like I'm walking a little taller. I kind of get my mojo back, start being just a little bit happier and feeling more like my old self because I'll forget to put myself on the calendar. And then all of a sudden, I'm like, what the heck is going on? Last time I forgot, I thought I was getting COVID again. My joint pain came back with a vengeance. And I'm like, oh my gosh, I got to test for COVID because I had a headache. I wasn't motivated. I didn't want to do anything. I didn't want to go out or do anything at all. And I'm
Yeah.
like, wait a minute, let me look at the calendar. And sure enough, I was due for my pellet. So I came home, popped a couple in there, and within a couple days, I was back to my old self. So as you get going with it, once we get those levels up, we want you to come back when you first start to notice some of the good things going away. We want it to dip down a little bit, but not
Yeah.
go back down to the gutter where we started. So
Right.
we want it to dip down. And so then you don't have that buildup period every single time. You do it that
Right.
one time, build up, and we like it to go a little slow because we don't want you to have this huge rush of hormones, like if you got an injection where your kidneys, heart, liver have to process this chemical. This is a
Yeah.
slow, gradual build up. It left the building slowly, so we're bringing it back in the first 4 to 6 weeks, and then they should feel pretty good. And then that's when we can really tweak things like, okay, what's left? What's left on your list that we didn't get?
Right.
And then we can dive into that and focus in on that.
I love it.
So I know we all want it. We all want everything. We're like 2 year olds. We want everything now and we want more.
Yeah.
And so what I've had interesting though is I've had many people, at least 30 to 40, call me at the day after the pellet to tell me that they had had the most delicious sleep they had had in years. And
Wow.
I'm like, that's placebo. And then I'm like, wait a minute, you can't placebo sleep. Either you're asleep or you're not. So there's
Yeah.
something to it. So I don't know if it's just hope, that things are going to get better or actually it's in the system.
Wow.
Yeah.
That's it's amazing, but I think I think for me, it was like between 3 months, I saw a slight difference. And then 6 months, I started to see a little bit more. 9 months, I definitely noticed a change. And then, like, towards the year mark, I was feeling great. I felt like a new
Yeah.
person.
Yeah, the creams are interesting because I have a few patients on creams, but usually if I do prescribe the creams, they'll twist my arm and make me do it. It's not my favorite because I know you're not going to feel as well as you do with the pellet. Usually within 2 weeks, they'll call me and say, give me a pellet, because the creams, you have to remember to put them on. They're messy. They can transfer to dogs and children. And they may not get you to the happy place. They may not get your levels up to where we can go with the pellet. And
Yeah,
I read a study once that shows over 45% of people don't absorb medication through their skin at all. So you could
really.
be paying for the consultation, you could be paying for the hormones and not getting any benefit at all. And I'll test women's labs that are on hormones, on the creams or gels, and a lot of times they don't even register.
Wow.
Yeah,
That's
so it's really kind of interesting. That's why my pellet is my drug of choice, is because it holds it so steady and even. You don't have that roller coaster of, say, an injection where you get this big dose of chemical your body has to process, and you feel like Superman, and then it wears down and you feel like crap. Then you get, it's a roller coaster going up and down, and it's the same with the creams, the troches, and shots and all that.
now for people with perimenopause or menopause, what are the top three symptoms that BHRT can meaningfully improve, and what's the trade-off discussion?
Well, I think, like I said, yeah, the sleep, night sweats, energy, mood, just getting yourself back to your old self. And
Yeah.
the what it is are you ready to take a chance, trust in a professional, lay a little bit of money down? It's $400 for women to get pelleted at my practice, and that's every 3 to 5 months. And so it works out to maybe 100 and change a month to really
Yeah.
feel well and get a little poke in the booty. And that heals up so quick. It's like a nothing, and it doesn't really scar. And since I've been doing this for 15 years, I thought maybe I should take a look back there. And I don't have an acne scarred butt. There's not a whole bunch of scars on there. They fade in as time goes on. And the guys that are concerned about their little scar, I tell them if they're posing for the magazines, they can just put a little dab of makeup on it, and then they're like, oh, no, never mind,
Oh, that's funny. That's funny.
So I have a lot of fun with my patients. We have a very happy practice. Women coming in for the first time not necessarily are happy because they haven't had their hormones yet. But once
Yeah,
they get on board, I've got a fabulous staff that's very welcoming and kind and understanding. And, we know women without their hormones can be a little bit rough.
right.
And so we try to get them balanced out ASAP. Once in a while, I'll declare an emergency pellet. Need to do it immediately. Get this lady feeling better.
Yeah. Now, is there a candidate who might not be good for BHRT?
Yeah, absolutely. If somebody's going through an active cancer treatment, that would be a hard no. And then it just depends on what they've gone through, and somebody going through cardiac, testing and all this. Like if they have AFib that's not resolved, I'd step back from it, because I don't want to step on other doctors' toes and get in the way of what they're doing or they're perceived. Even though I know it's safe, they don't. And so I have to respect that. So I take them one by one.
Right.
I've had guys that have had prostate cancer that had their entire prostate removed that I pellet and they feel so much better.
Mhm.
So prostate cancer, I like to get the blessing from their doctors
Yeah.
to go forward with the therapy, because the last thing I want to do is to step on their toes and create bad feelings in the community, or have the patient feeling that like I put them at risk for something. Because just because I believe truly that it's healthy for most people, not everybody believes that. And the doctors, they, if they're not up on it, they're down on it. If they don't know it, they don't want it. It's like taking a bottle of supplements to your doctor and say, hey, can I take this? And they're like, I don't comment on supplements.
Yeah.
That
Yeah.
was a cardiologist, and it was five Ayurvedic herbs in one pill, and I thought this is fabulous, And
Yeah.
what do you think of this? Oh, I don't comment on supplements. There is
Now,
one supplement I do recommend for everyone on hormones, and even young girls without taking any hormones. It's called DIM, diindolylmethane. Do you take that?
no, but I'm going to look
Oh
into
my
it now that
goodness.
you said it.
It's fabulous. What it does, and I learned this when I very first started doing bioidentical hormones, is if you bring estrogen in or produce estrogen and you don't have the DIM, picture it like the lotto balls with those, like, say, six different channels it can go down.
Yeah,
The
yeah, yeah.
lotto ball can go down this channel, which is healthy, or this one that's not so healthy. The
Right.
DIM pushes it down that 2 hydroxy pathway, which is the
Really?
safest way to metabolize your hormones.
Wow.
If it goes willy-nilly over into the sixth column, it can lead to estrone, which has a correlation with breast cancer and all that. So
Yeah.
I find it very important that both my women and men take DIM. And for women, they take one a day, it's 150 milligrams, and for men, two a day. And I actually private labeled it. I have my own supplement line on our website, and it's very pure, American made, clean, well handled. I just wanted to get my pay and good pricing. I just wanted to get my patients good supplements because I did a I've added in different supplements that I really feel complements what we do. And I
Yeah.
wanted to be able to provide them with good ones. And plus, there were some that I wanted myself that they were discontinuing. So there was a great probiotic that has a patented capsule that opens in the beginning of the small intestine instead of your stomach, like all the others. So it
Yeah.
has all that time, all that microbiotic can replace and repair the inside lining of your intestine. So I private labeled that so I could have it. And then I share that with my patients. They can have it too. And we also sell our brand on Amazon. If you use Amazon Prime, there's low TE Florida supplements on there. But it is an interesting thing because when I first started doing this, and then as time goes on, I'm recommending more and more supplements, like if their D is low or their B12 or whatever. And so I have a video that runs in my front office in the reception area, and it's also on our website on our shopping page that I do an interview with Dr. Derek De Silva, and he's from up in your neck of the woods. He's more New Jersey. And he's like a nutritional guru. And so I'm interviewing him. It's a fun interview, but it explains how what I'm recommending actually ties into what we're doing with the hormones. Because I feel like sometimes, oh, you came in to get your hormones fixed and you end up with a little bag of supplements. Like, what the heck? And so this goes through each supplement and why it's important for your body and why you should be
Yeah.
utilizing it. And also how to utilize it safely, like iodine. Yeah.
Yeah. Exactly. I think it's really important that people know what they're taking and why they're taking it and what it's actually going to do to their body. And I guarantee if you ask most people, they have a pharmacy in their pantry and they have no clue. They think it's what they need because someone says it's good, but it
Yeah.
might not actually be a good product or it might not actually be
Right.
the right product for their body.
Yeah.
And.
Well, I saw it on Facebook, so it should be good.
Oh, I'm not talking about you in general. I'm talking about like overall, like,
I'm
I
teasing.
I see
No,
so many people like they'll go to Costco and they'll just pick up a bunch of vitamins that they think their age group should have, and they don't even know what's in the back of the label.
and they don't know how those have been treated. They've probably been sitting in a hot warehouse for a year. Honestly, you buy it from a big box store, if you test it, it's probably inert.
Right.
I even had one from a big company that I was bringing in. I had it tested. I test all mine with an outside lab to make sure it's exactly what I'm saying it is, and that there's
Yeah.
no impurities, and that it is a proper strength and all that. I do that for several batches, and I found one that I was buying from a very famous company was totally inert, had nothing in it. It was supposed to be a
Wow.
vitamin D. Yeah. So you need to be really careful where you buy your supplements and make sure they're reputable, they're handling it properly. We go through so much that it's always fresh, and that's important.
That is very important. Totally.
Hmm.
Now, For I had one question for you, like for what's the overhype of hormone and the longevity, right now? Like what's quietly being promised in our society?
I don't know. I just come to work, so I don't know what society say. Very social, so I think people want that quick fix, and
Yeah.
the big thing is the energy and the sleep. And if
Yes.
you don't get it right off the bat, then they're like, nah, this didn't work. No, we got
Yeah.
to work on it together to dial it in and try some other things. Maybe even do a sleep study. There's
Right.
other things to do other than just hormones, because a lot of people think that everything that's wrong with them is hormone related. Well, my little pellets can't fix your relationship. So
Yeah.
if you have a low libido or a low sexual function, you might want to take a look at the relationship, after we've optimized your hormones. Let's see where we
Exactly.
are, but
Right.
then we can do that deep dive and see, why are you not feeling that well, and it's just like, well, my mood is bad. Well, what's going on at home? Oh, well, my husband just left me. Oh, well, there you go. And they think the pellets can fix everything or hormones can fix everything, I guess.
Yeah.
And we can do a lot. And I've helped people that even have true mental illness feel better. So the hormones do play a big deal. Like they did a study with our hormone pellets with returning war vets and first responders for PTSD. And it was a qualitative study that was just beautiful. I mean, the testimonials from these people about how optimizing their hormones changed their lives. It helped with their nightmares, with their sleep, with their moods, their energy, their relationships. They felt more like getting out and exercising, getting more involved in their relationship. So there's a lot there, but it's not the end all. There's of
Yeah.
course other factors in your life that you may want to take a look at. Yeah.
Right. Exactly. Now, if you had to take today's conversation, you wanted to emphasize on some important factors, what are some of the things that you'd want the listeners to walk away remembering?
From all my studying, all my teachings, reading, everything else, I truly believe that hormones are safe. There is
Hmm.
not one study that shows that estradiol, what we use, causes breast cancer. Not one. They just went to the FDA to take the black box warning off the label because it's just not true. And the testosterone that I love the doctors that say, male doctors usually, that women don't need testosterone. Absolutely. Your body produces that. That's a happy hormone. Helps with
Yeah.
your mood and energy, libido, sex drive, sexual satisfaction, everything,
Yeah.
So I guess that's about it. Yeah.
I think that's great. And if people want to read your book, they can go on on your website and get it.
Yeah. Yep. Low TE Florida spelled out.com. And the book is Are You Hormone Curious? If you want it on Audible, it's on Amazon. And if you want a hardcover, it's on Amazon as well. But I'd love it. I did this just to share the good news, because I'm obviously clearly passionate about hormones. I drank the Kool-Aid, I'm walking the walk, and I
Yes.
just wanted to share that with others because there's so many women suffering
Yes.
needlessly, needlessly.
Hmm.
Oh, my mother, I have a family history of breast cancer. Okay, this isn't going to cause it.
Yeah.
Breast cancer can happen with or without hormones.
Right.
But and it takes 7 to 10 years from the time the cells first decide to go bad before you can
Yeah.
even find it. So if I
Mhm.
pellet you tomorrow and in 3 months you come down with breast cancer, oh, the pellets cause the breast cancer. No, it's coming down the pike. But because
Yeah.
we insist on mammograms for our patients, we catch it early and it becomes like cut it out, couple zaps of radiation, and you're on your way. My patients
Exactly.
have, I've had a handful that have come down with it, and they described it as an inconvenience. I'm
Yeah.
not letting this define me. I'm not wearing pink. I'm just going, taking care of it and going forward.
Right. This is
But
great.
pink's my favorite color, so I wear
I
pink.
can see that. Yeah. Purple's mine.
I see that.
I gotta say, this has been wonderful. I thank you so much for coming on this show, and I thank you so much for being so passionate about what you do and helping so many men and women. So many women, especially, go through life and they go through all these changes and they just, they don't know what to do. They don't know what the right answer is. They hear myths, they're afraid. And I'm so glad you're dispelling the myths. I'm so glad you're out there with your practice and you're helping so many women and men get their lives back in order and feel good about themselves. Because even with when it comes to testosterone, men suffer from this. I think it's the age of 29 they start with erectile dysfunction. You know,
Exactly. That it could start to plummet, especially if they played contact sports, if they've had concussion, that can drop it way down. Like I've got a couple ex-professional football players that I treat. It just goes down into the gutter, and so and it's not necessarily age related. I've had a guy that was in his early 30s, his testosterone was far lower than his father that I treat when I started him. And so
mhm,
it's not necessarily age related. It's just when your body's done, it's done, and it's not going to come back. It's not going
right.
to start cranking out more hormones on its own. So you got to
Yeah.
get that optimized. But with my practice, I feel it's an honor and a privilege to be able to help women and men feel better because what I love about my practice is I can take somebody that feels not good, horrible, or just not, just plain blah,
Yeah.
and give them hope during the consultation of what I hope to be able to restore in their lives and then
Yeah.
actually make it happen. So I'm
Right.
very, very fortunate that I'm in a great position to be able to help a lot of people, and I love what I do.
I love it. I love it. Well, thank you so much, Caroline, for coming on the show. Thank you for everything you do. And I'm so honored to have you on this show. So I really thank you, because you're helping so many men and women out there and you're doing a wonderful job doing it. So thank you so
Well,
much.
thank you, Stacey. With you and me together, we're going to enlighten the world on the
Yes,
beauty of bioidentical hormones.
100%.
Yeah.
Definitely.
All
Well, you,
right.
you have a great day.
You too. Thanks.